Hello guys, Vanakkam and welcome to Meteor Academy, one of the leading academy in training nurses in the nursing competitive exam, IELTS OET training, and also we are doing abroad nursing placement services. And today we are going to discuss about important psychiatric MCQs for upcoming ESI exams. And if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Let's begin the session. The first question is, all of the following are seen in anxiety except. This question asked in Kerala 1996. The option given here are decreased sweating, cold extremity, hyperventilation, palpitation, pupillary dilatation. And here the correct answer is option A, decreased sweating. Why I selected this option? What is the rationale behind this? Listen to the question carefully. All of the following are seen in anxiety except. So, during anxiety situation, when the sympathetic nervous system activity is stimulated, immediately increased sweating will take place. Whereas here in this option they have given decreased sweating. So it is a wrong one, that's why I selected this option. Apart from that, whenever the sympathetic nervous system is stimulated, apart from increased sweating, heart rate is going to increase, respiratory rate is going to increase, palpitation is going to be there, hyperventilation will be there. All the peripheral blood vessels will be getting contracted and sending the blood or bypassing the blood to important vital organs like brain, lungs, liver, heart. These are all the vital organs. So the blood vessels in the peripheries, it will get contract and it will send the blood to all these vital organs. So the peripheries is going to be cold. Pupillary dilatation. Whenever the sympathetic nervous system is activated, pupillary dilatation will take place. Instead of contraction, what will take place? Dilatation. So all the options are related to what? Sympathetic nervous system activity stimulation during anxiety, except decreased sweating. That's why I selected option A. The next question is, General Adaptation Syndrome, in short GAS, is seen in. This question asked in AIMS 2012. Here they have given 4 options like panic attack, depression, anxiety, stressful situation. And here the right answer is option D, stressful situation. In order to answer this question, you should know the meaning of GAS, General Adaptation Syndrome. Let's see the rationale. General Adaptation Syndrome is nothing but how your body is responding to the stress. The stress might be of different thing like trauma, examination, work stress, whatever it is. How your body is going to react to a stress, that is called as GAS, General Adaptation Syndrome. And it consists of 3 stages. The first one is alarm reaction stage, second resistant, third exertion stage. In alarm reaction stage, once your body felt the stress, experienced the stress, immediately the information is sent to the brain. And brain will react by secreting fight or flight hormones like glucocorticoid and adrenaline. This is called as alarm reaction stage. The second thing is resistant. Our body is fighting back in order to adjust with the stress. Let me give an example for alarm reaction stage, the first stage. Suddenly a dog is running behind you and you saw the dog, immediately that information is sent to the brain. The fight or flight hormones like glucocorticoids and adrenaline is released in the alarm reaction stage. In resistance stage, you started to run. You are fighting back. How you are fighting back with the stress? You are running away from the dog. And the last one is exhaustion stage. Your body is getting exhausted. Okay, so that is called as exhaustion stage. When you are running long, that time you are feeling very tired. That is called as exhaustion stage. So these are all the 3 stages of GAS, General Adaptation Syndrome. So in which condition you can see general adaptation syndrome? We can see general adaptation syndrome in stressful situation. That's why I selected option D. Next question is, general adaptation syndrome relates to how we achieve homeostasis, how well we adapt to new situation, pattern of psychological response to stress, pattern of autonomic nervous system, and physiological response when we are aroused by a stressful situation. This question also asked in AIMS 2012. And here the right answer is option D, pattern of autonomic nervous system and physiological response when we are aroused by the stressful situation. So just now I have given the explanation about GAS, general adaptation syndrome. Whenever you are experiencing any kind of stressful situation, immediately the autonomic nervous system is getting activated. Once the autonomic nervous system is getting activated, the sympathetic nervous system stimulation is going to be there. That's why I selected option D. Which of the following is the most common psychiatric disorder? Anxiety disorder, schizophrenia, mood disorder, mania. This question asked in DNB NEET 2014 as well as 15. And here the right answer is option A, anxiety disorder. Why anxiety disorder? The research says that anxiety disorder is the most common psychiatric disorder among all. And followed by anxiety disorder, the second most common psychiatric disorder is mood disorder. The first one is anxiety disorder is very common and second one is mood disorder. That's why I selected option A, anxiety disorder. The next question is, all are seen in generalized anxiety disorder except option given here are muscle tension, irritability, fear of impending doom, restlessness. And here the right answer is option C, fear of impending doom. Why I selected this answer? Whenever the patient is experiencing generalized anxiety disorder, the person can face severe muscle tension, irritability, restlessness, difficulty in concentration, nervousness. These things are very common. These symptoms are very common. Whereas fear of impending doom, it is a classical manifestation of panic disorder. What is fear of impending doom? See, as I mentioned already, it is typically seen in panic disorder. It is the feeling that something terrible is going to happen. The panic attack versus anxiety. What is the difference between panic attack and anxiety? That is also very important, you should know. In panic attack, the symptoms, causes, risk factor may be similar, but the panic attack is more intense, which accompanied by other physical and mental symptoms. Whereas in anxiety, it is an emotional and protective response. In a simple words, panic attack means the symptom is going to be same like anxiety, but it is going to be, intense. Intense means severe. All the symptoms are going to be very severe. Whereas in anxiety, it is just an emotional and protective response. Let me give some examples so that it will be very easy for you to understand. In panic attack, the person may experience chest pain, rapid heart rate, shortness of breath or choking, feeling of detached from oneself. Whereas in anxiety, as I mentioned already, restlessness, nervousness, irritability, difficulty to concentrate, muscle tension, these generalized normal symptoms will be there. So this is the general difference between panic attack and anxiety. Drug of choice for generalized anxiety disorder. Option given here are alprazolam, buspirone, venlafaxine, beta blockers. And here the right answer is option A, that is alprazolam. Why alprazolam? Usually benzodiazepines are the drug of choice for generalized anxiety disorder. Alprazolam is a drug of benzodiazepine. That's why I selected option A. True about generalized anxiety disorder. This question asked in PGI November 2017. Insomnia, hypersomnia, episode lost for minutes to hours, free floating anxiety, benzodiazepine is the treatment of choice. Autonomic symptoms. So these are all the options given here, and here the right answer is option A, D, E and F. A, D, E and F. Why? In generalized anxiety disorder, insomnia will be there. Free floating anxiety, always the person will be having some kind of anxiety, either about the future, about the past, about the present, what is going to happen. Always there will be some kind of anxiety, that is called as free floating anxiety. And benzodiazepines, obviously just now we discussed in the last question, for generalized anxiety disorder the first drug of choice is benzodiazepine like alprazolam. And autonomic symptoms like nervousness, restlessness, muscle tension, these things will be experienced. Because of free floating anxiety, the person will be having insomnia, but hypersomnia it will not be there, and episode lasts for minutes to hours. Minutes to hours episode will be lost. These two things are wrong answers. A 30-year-old lady present with sudden onset of breathlessness, anxiety, palpitation, feeling of impending doom. Physical examination does not reveal any abnormalities. What is the probable diagnosis in this case? This question asked in AIMS November 2010. Option given here are panic attack, anxiety disorder, conversion disorder, acute psychosis. And read the question carefully. Here they have mentioned few important classical manifestations like fear of impending doom, onset of breathlessness suddenly, palpitation. So these are all the manifestation of what? Just now we discussed about the panic attack, right? So these are all the manifestation of panic attack. That's why here the right answer is option A, panic attack. Apart from that, here they have given about conversion disorder. We know about anxiety disorder, that is the second option, no need to discuss it again and again. The third option C is conversion disorder. So what is conversion disorder? Conversion disorder is a type of somatoform disorder where physical symptoms or signs are present that cannot be explained by the medical investigations. As I mentioned, it is a kind of somatoform disorder. What is somatoform disorder? It is a mental disorder manifest as physical symptoms and cannot be explained by the medical condition. Same. There are 4 types of somatoform disorder like hypochondriasis, somatization, conversion, persistent somatoform pain disorder. These are all the 4 types of somatoform disorders. We will be discussing about these things later. Now you should know the concept. What is conversion disorder? That's why I have given this explanation. Apart from that, the last option they have given acute psychosis. The meaning of these words are, it is a serious mental health condition where the patient becomes disoriented from the reality and experience hallucinations, delusions, etc. Here the person become disconnected from the real world. They have disconnected and they will be experiencing illusion, hallucination, delusions, etc. Okay, so here the right answer is option A, panic attack. Panic attack is associated with a disturbance in all of the following neurotransmitter except. This question asked in AIMS November 2011. Options are serotonin, GABA, glutamate, dopamine. And here the right answer is option C, glutamate. Glutamate is a free amino acid in brain and it also acts as a neurotransmitter, but it is not at all responsible for panic attack. That's why we selected this option. Differential diagnosis of panic disorder or. This question asked in PGI June 2004. Here they have given 5 options: pheochromocytoma, myocardial infarction, mitral valve prolapse, depression, carcinoid syndrome. And here the right answer is option A, B, C and E. Pheochromocytoma, myocardial infarction, mitral valve prolapse, carcinoid syndrome. All these 4 are correct answer because these disease symptoms are going to be similar like panic disorder. That's why they are coming under differential diagnosis. What is carcinoid syndrome? Because all other options you might be known, like pheochromocytoma means it is a tumor in the adrenal gland, and secretion of adrenaline, all those other hormones will be there, right? So whenever there is a secretion of adrenaline, the fight response will be there, heart rate will be increasing, respiratory rate will increasing, sweating will be there, right? And myocardial infarction, mitral valve prolapse, also same, palpitation will be there, abnormal heart rates will be there. And carcinoid syndrome means it is a neuroendocrine tumor, means in our body, different areas neuroendocrine tumors will be formed, and it is started to produce too much of hormones. Whenever there is an hormones which is present in our body, it is going to be metabolized in the liver or processed in the liver. Okay, but too much of secretion of neuroendocrine hormones, for example serotonin, these type of hormones are continuously secreted, and it is going to the liver, and the liver is not having the capacity to metabolize all the hormone, too much hormones at a time. So the liver is getting affected, and it is creating some symptoms which is going to be similar like the panic attack. That's why this carcinoid syndrome is also coming under what? Differential diagnosis of panic disorder. On the whole, which is not a one which is coming under differential diagnosis? Depression. That's why option A, B, C and E are correct. Which of the following is the most appropriate treatment for panic disorder? This question asked in AIMS 2009. Options are buspirone plus benzodiazepine, benzodiazepine plus supportive therapy, short-term benzodiazepine plus SSRI plus cognitive behavior therapy, long-term benzodiazepine plus venlafaxine. And here the right answer is option C, short-term benzodiazepine plus selective serotonin reuptake inhibitor plus cognitive behavior therapy. Option C is the right one. Which of the following does not resemble panic attack? Hypoglycemia, generalized tonic-clonic seizure, temporal lobe epilepsy, myocardial infarction. This question asked in NIMANS 2019. And here the right answer is option B, generalized tonic-clonic seizure. The rationale behind this is, patients with generalized tonic-clonic seizure have tonic and clonic movements. Underline the word tonic and clonic movement, which are not seen in panic attack. Whereas temporal lobe epilepsy can present with psychic symptoms like anxiety symptoms. And this is going to be the differential diagnosis for panic attack. And if there is hypoglycemia and myocardial infarction, the symptom is going to be same like panic attack. So hypoglycemia, temporal lobe epilepsy, myocardial infarction can consider as a differential diagnosis of panic attack, whereas tonic-clonic symptoms will not be there for the patient with panic attack. So we selected option B. Which of the following is not true regarding treatment of panic disorder? This question asked in NIMANS 2019. Monoamino oxidase inhibitor are given in associated atypical depression. Dose of SSRI is double to control initial symptom of panic disorder. Voluntary exposure is a part of psychotherapy. Acute management of anxiety is with benzodiazepines. These are all the options they have given. And here the right answer is option B, that is dose of SSRI is double to control initial symptom of panic disorder. Fear of dark is called as nyctophobia, agoraphobia, claustrophobia, acrophobia. This question asked in NEET 2019. So here the right answer is option A, nyctophobia. So nyctophobia means fear of darkness. Agoraphobia is a fear of place or situation that you can't escape from. Claustrophobia, it is an intense fear of confined or closed space or closed place. Acrophobia, fear of height. true about social phobia is fear of closed space, irrational fear of situation, irrational fear of activities, irrational fear of specified object. And here the right answer is option B, irrational fear of situation. A middle-aged person reported to psychiatric OPD with the complaints of fear of leaving home, fear of traveling alone, fear of being in crowd. He developed marked anxiety with palpitation and sweating if he is in these situations. He often avoids public transport to go to his place of work. The most likely diagnosis is generalized anxiety disorder, schizophrenia, personality disorder, agoraphobia. This question asked in AIMS May 2006. Listen to the question carefully. The person is having fear of leaving home, fear of traveling alone, feeling of being fear in crowd. So these manifestations are commonly seen in the person who is experiencing agoraphobia. Agoraphobia is nothing but it's a fear of places or situation that you cannot escape from. Here in this question they said that the person is having fear of leaving home. He feels very comfortable within the home. When he is going out, he is feeling unsafe. He is feeling that he can't escape from the situation whenever he is seeing a crowd. Okay, so here the right answer is option D, agoraphobia. Agoraphobia is often seen in patients with generalized anxiety disorder, social anxiety disorder, panic disorder, OCD. And agoraphobia is often seen in patients with option C is the right one, panic disorder. A 50-year-old male feels uncomfortable in using lift, being in crowded places and traveling alone. The most appropriate line of treatment is counseling, relaxation therapy, exposure and response prevention, covert sensitization. This question asked in NIMAS 2016 and AIMS 2005. Listen to the question carefully. The male feels uncomfortable in using the lift, being in crowded places and traveling alone. These are all the manifestation of agoraphobia. And the line of treatment for agoraphobia is exposure and response prevention. So C is the right answer. And D, that is covert sensitization. I would like to give the explanation for this. Covert sensitization means it is also called as verbal aversion therapy. Here, the individual has to imagine to produce unpleasant stimuli. For example, a person is an alcoholic, chronic alcoholic, and ask the patient to close the eyes and imagine the highly disturbing and unpleasant consequences of drinking, such as horrible nausea and vomiting. This thought will disturb the individual and stop drinking. This is called as covert sensitization. Treatment of choice in phobic disorder is psychotherapy, benzodiazepine, behavior therapy, 5-HT reuptake inhibitor. 5-HT reuptake inhibitor means nothing but SSRI. And here the right answer is option C, behavior therapy. What is behavior therapy? It is a type of psychotherapy. There are different types of psychotherapies like cognitive therapy, counseling therapy, behavior therapy. So in behavior therapy they are using CBT. It is cognitive behavior therapy. It is a short-term talking therapy. Underline the word short-term talking therapy to manage the problem, stress, anxiety by changing the thinking, thoughts and ideas of the patient. This is called as behavior therapy and it is used for the patient with phobic disorder. Agoraphobia is treated with systemic desensitization, psychodynamic therapy, exposure therapy, relaxation therapy, behavior therapy. This question asked in PGI December 2007. And here the right answer is option A, B, C, D and E. All are right answers. Hope everyone knows the meaning of everything. Systemic desensitization, psychodynamic, exposure, relaxation and behavior therapy. So let me give an explanation for psychodynamic therapy. Psychodynamic therapy, it deals with the unconscious psychological process that can influence an individual personality and everyday experience, like fear of mice, nail biting, like that. Okay, so in psychodynamic therapy, they deals with the unconscious psychological process. Unconsciously they will be doing the nail biting, unconsciously they will be having a fear of cockroach, fear of mice. Okay, they will be dealing this unconscious psychological process. Okay, so that is called as psychodynamic therapy. So guys, I'm ending the session here. If you have any doubts anywhere, please drop your message in the chat box. We have made a maximum effort in order to explain each and every options, in order to understand the rationale behind each and every options. So if you have any doubts, please drop your message in the chat box, and if you want to contact us, please contact in the phone number and mail ID given here. And same like every year, this year also we are very proud to say that hundreds of students got selected in AIMS NORCET 2022 as well as JIGMER 2022 exams. So if you want to be one among them, so you have to train yourself. You have to solve at least 100 questions per day. That is very important, along with the rationale. Solve the question along with the rationale. Apart from that, the time management is very important in solving the question. See, understand the question very fastly and also understand the rationale behind each and every options, so that it will be easy for you to solve the question easily. So we are conducting online and offline batches. Online batch is going on in New Delhi, and offline and online hybrid classes are going on in Pondicherry branch. So if you want to contact us, you can contact in the phone number given here, and the classes will be from 5 p.m. to 7 p.m. 4 months duration. So hurry up, only few seats are remaining. Thank you very much. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Share the video as much as possible so that everyone will get benefited from this. Thank you once again.